Learning the rules, barrier rules, creating a clean surface. A presentation brought to you by 4YourCNA.com. In this lesson, we will talk about barriers. Barriers are used to create a clean surface for your clean supplies. If you remember the opening, we had to knock, identify the patient, introduce ourselves, describe the skill, and obtain permission, all before closing the curtain and washing our hands. And then we can gather supplies. This order is important. The patient has to know what is being done and have the right to refuse. Don't bring supplies into the room with you because that is presumptuous and minimizes the patient's right to refuse. You must do the opening before you get your supplies. This is an important principle. You also have to have clean hands to touch your clean supplies. If you bring supplies into the room with you before the opening, you will have touched the supplies before you washed your hands. But once you have done your opening and washed your hands and gathered your supplies, you're going to need a clean place to put those supplies. You can't simply place them on the overbed table because the table isn't clean. Overbed tables are used by the patient as well as a staff. They will often hold personal grooming items, tissues, cell phones, activity books, and food. They may have grape jelly on them from breakfast or gravy from dinner. They may have body fluids from used tissues or urinals. They are never considered clean, so we can't put our clean supplies directly on the table. So what we need is a barrier. A barrier can be anything that separates the clean supplies from the dirty table surface. A paper towel can be a barrier. So can a washcloth or a bath towel. Anything clean and solid will work. But we usually use a very specific type of barrier called chucks. Chucks are waterproof, absorbent, and readily available in clinical settings. Their technical name is disposable underpad, but most people refer to them as chucks. That's because they are the type of underpad that you chuck after you use it. Because we are often working with body fluids, using an absorbent chucks as a barrier keeps fluids from contaminating the table or dripping off. But it is best to get your chucks before you gather your supplies so that you have two free hands to spread it out over the table. It's hard to spread it out when you're holding a bunch of supplies. And you can't let those supplies touch your uniform. Your uniform is not clean. Think of all the things your uniform has brushed up against as you work, like the sink, bed, drawers, curtain, drainage bags, medical equipment, bathroom area, and even the nurse's station. Plus, you may have knelt on the floor to do foot care, tie shoes, put socks on a patient, or empty a urine bag. You do not want those clean supplies to become contaminated by your uniform. Never let any supplies, clean or dirty, touch your uniform. So getting a barrier is the first action we take after washing our hands. That way we aren't juggling all those supplies while we are trying to get the chucks ready. So, simply perform your opening, wash your hands, place a barrier on your table, and then gather the rest of your supplies. A barrier will be used for all skills that require supplies. There are two exceptions. Feeding will not require a barrier because the food tray is the barrier. And a barrier can be used for bedpan, but the skill is often done without one, since most people don't like to put a bedpan on an eating surface, even with a barrier. Instead of placing the bedpan on the table on a barrier, most CNAs simply get the bedpan out of the drawer after all preparations are done, eliminating the need for a barrier for this skill. You will learn more about this during the bedpan skill. The barrier is part of every puzzle chain that requires supplies. Remember all the rules regarding using a barrier to provide safe care.